So I'm going to concentrate mostly on the high path AI outbreaks that we've had in the United States just recently, the one in Indiana, and of course the one that was 2014 and 2015 that started on the West Coast and progressed east to the Midwest. What we've gone through in USDA with the help of our partners at the states, the state departments of ag, and all of the poultry industry has really been an evolution in response and planning. We have new rules, new thoughts, and I think a new program when it comes to this. So first of all, a little bit about the outbreaks. And before I start, let me talk about partnership. We can't do this alone. We can't do this without the state departments of ag. We can't do this without the industry. When we march into an area, when we're asked into an area, we work under their authority, that state's authority. Each state has different rules and regs with many aspects of the things that we'll be working on, and we depend on them to help us and lead us through that and to have that preparation when we come in so that we can efficiently and effectively deal with the outbreak. I can't say enough about that partnership in all the states that we go to and what we learn as we go to each state and what the industry learns as we work with them and how that partnership has helped us in the development of the plans that we have and the thought processes that we put together. That's really something that we want to continue. We want to continue to build on. If we work together, I think there's really nothing we can't accomplish. So a little bit about the 2016 outbreak in Indiana. We hadn't seen, and we were holding our breath, of course, we hadn't seen high path since June 16th of 2015, and we were thinking we're in pretty good shape. And as part of Indiana's NPIP testing for movement in markets, they tested a flock, and it came back, of course, as a high path H7N8, which was different from the virus that we saw in the 2014 and 15 outbreak, which was an H5N2. The majority of the flocks that were infected had an H5N2. Hadn't seen this one, hadn't seen it in poultry, and really from our surveillance of the wild birds, we hadn't really seen much in the way of virus in the wild bird population. We had an indicator in that there was a low path H7N8 that was highly similar to the high path virus that we were seeing in Indiana earlier in that month, or the month before. So this was in a turkey flock. The calls, of course, occur immediately, and surveillance occurred immediately. Indiana began to look within their control zone to see if there was any spread. And interestingly enough, the spread that they found was not a high path virus, but a low path H7N8 that was occurring without clinical signs. They found that within the control zone in 8 flocks. They also found, or also had so those flocks were going to be treated, of course, as if they were high path. We attacked that from the same perspective. We didn't want spread. We didn't have all the epi in yet, but as the epi did come in, it was clear that this low path H7N8 was circulating in these flocks, and it reassorted and became high path. By the genomics that were run by the National Veterinary Services Lab, that became quite clear and evident. These are highly related viruses. So Indiana marched quickly. We dispensed a incident management team to deal with the virus and the outbreak and work with Indiana. Indiana, of course, had its own field force on the ground. There was a strong partnership that worked along with the Department of Homeland Security. The incident command post was established quickly, and work was set about to eliminate the flocks that were infected. Unfortunately, it was January in Indiana. It's very cold. Our goal, as Dr. Roth said, was 24-hour depopulation. We learned that from the 2014-15 outbreak. So we set about to do that, and we dispatched foaming units And the company itself, the industry company that was affected, also had a foaming unit, and they started to depopulate their flocks with those units. Fortunately, it was below zero. The unit froze. The foaming unit didn't function. They don't function well when they're frozen. You need water and you need it to be liquid so you can create the foam, of course. And so the company made a decision, along with in discussions, to simply turn off the fans. They didn't. That's not ventilation shutdown as we define it. They turned off the fans to prevent spread of viruses. This was a densely populated poultry area, and they didn't want the virus to be blown out the fans to other premises that were close by. So in all, those 8 premises were depopulated. The high-path initial premises was depopulated. Different methods were used on the farms. Ventilation shutdown, along with gas, along with KEDs and TEDs and foam, all were used. And on some farms, they used a combination of all those methods. We, of course, were challenged by the weather. There was also one laying facility that was a dangerous contact that was taken out, and that was part of the EPI process. That was a laying facility. So other than that, they were all turkey farms. We did an EPI report that was released on March 4th, of course, and as Dr. Roth has said, as John has said, basically it shows the same story, that if biosecurity has if there are any letdowns any place, that's an avenue that this virus spreads. This is a tough virus to keep out. We saw the same thing in the flocks in Iowa, Minnesota, across the nation. And as Dr. Roth said, biosecurity is expensive. Biosecurity is geared for domestic diseases. It's not geared for this virus. Historically, if you look at high-path outbreaks across the country, across the world, it shows that there are point source outbreaks that occur, and then people, machinery, vehicles, so on, spread the virus. So it's a tough one to keep out. I think to fault the industry for poor biosecurity is not the way to go. I think the direction we've decided to go is to build that partnership to help guide that biosecurity planning and assist them, because they want to do it right, and they want to be profitable, and they understand the need for biosecurity. Now we'll talk about the 2014-15 outbreak. As many of you know, it started on the West Coast, and we had little point source outbreaks in many of the states, and the states handled them quickly, and we thought, well, this isn't really going to be that big a deal. Then the birds went south, and we waited for them to come north in the spring, and they came north with a vengeance. And we began to see point source outbreaks, first in Missouri, then in Arkansas, then in other states across the Midwest. But it sort of took hold when it got to Minnesota and Iowa. Now, there's different theories on why that happened. Some folks feel that the point source outbreaks came when the birds migrated through. They deposited, of course, the feces on the fields, and then when the farmers went to plow the fields, it was a cold, wet spring with a lot of wind, and the dust particles, and there's research to show that the dust particles can move this virus fairly successful. The dust particles got raised, and they simply sucked them right into the ventilation, into the fans, into the birds. A lot of theories. Maybe people brought it in. Maybe there was just no way to keep this thing out without the proper ventilation sources to prevent the virus from coming in through those fans. We won't know. We don't know. We just need to take and look at that kind of research and give it heed and move from there. So a little bit about what went on. Of course, we had 232 premises across the nation that became infected. Of those, 211 were commercial, which follows what we saw in Iowa. There weren't that many backyard flocks. It's always been the fear of the industry that the backyards would infect them. This is an example in my estimation of amplification of virus based on numbers. Once this virus gets into a large poultry operation, and we have some flocks, some facilities in Iowa that house up to 7 million birds on one site. You can see the virus amplification possibilities there, and it's just simply a factor of the laws of nature. We ended up taking out 50 million birds. When I first went to Iowa in April, we had probably 500 roll-offs, semi-roll-offs, loaded with dead birds, waiting to go to wherever we had to dispose of them. And that was the problem, because we didn't have a disposal plan. We didn't know where we could take them. The landfills weren't real interested in them. We were trying to jury-rig incinerators so that they could burn the birds. Composting was working on the turkey industry, but you can't compost laying hens because many of these facilities didn't have the space. So we had many challenges in that respect, and it wasn't until the landfills opened up and we got to move those birds, and we engineered some of the incinerators so that they would functionally work to incinerate these birds that it worked. So all that being told, we spent a lot of time figuring things out as we went along. And after that happened, our Secretary of Agriculture and our administrator and our deputy said, we need a plan. And we sat down to formulate that plan. And that plan was formulated with the help of industry, with the help of state officials that we brought in, with the help of the universities and academia. And we put that plan together, and I think it's a good plan. Not that it's perfect. It can be we need to re-engineer it as we go, as we face new challenges, but at least now there's something out there for folks to go to, for folks to look at. Dr. Roth mentioned the secure egg and secure egg supply plans. All those plans are beneficial, but they're only as beneficial as the partnership of the states that are willing to accept what's in them. So those agreements are important, and for Iowa to continue to move product and for Minnesota to continue to move product, it was the states that accepted that and allowed that to happen that made those plans work, and that was beneficial. We spent over $800 million in the response to the indemnity, but that's really not correct. We spent $200 million in indemnity, and when I speak to indemnity, I'm talking about what you pay for the birds. The rest is what I call recovery and cleanup costs. And we spent over $600 million on that, so you can see it's 3 times what you spent on the birds. And through the process of working on this outbreak, we decided a lot of things, and I'll talk about those in regards to biosecurity and how that got us there. But the bottom line is, looking at the cost of cleanup, we decided what is clean, how do you define clean, and where do you go with that? So we worked together to say we really aren't interested in clean. Some of these facilities may have had up to 5 years of manure stored on site. Do we clean that up? How do you clean that up? So plans were changed, thoughts were changed. We're looking for virus elimination. We're looking for how do we get the virus off the facility? What techniques and processes did we need to use to do that? And I'll talk about our cleanup procedures and what they cost beyond the $600 million and how we formulated that in just a little bit. So simply enough, biosecurity applies to all aspects of the operation. When we look at the epidemiology of this disease, there's lots of things that are additive that cause a disease, things that you can do and things that you can do to prevent it. But we need a better horse to get to market. So we looked at what could be done different, and one of the things we faced in the federal government is when we go ask for emergency funding, they ask us, well, what are you going to do with that, first of all? What are you going to do to prevent this from happening again? And what's the contribution of the industry and the states? Those are questions we face. So in our fall plan, as Dr. Ross said, we devised a basic biosecurity plan. It's a template for the industry to go in, and OMB wants some assurances that we're taking steps to make sure this doesn't happen again, or that people are taking steps, that the industry is taking steps. So that basic plan will start out very simply, as Dr. Ross said, by the producer saying, I have a plan and I'm following it, and it follows these guidelines. As time goes on, we expect to make that plan more stringent and have it be additive so that it gets to a point, and it's designed by the industry themselves and the different sectors of the industry to deal with how they're going to deal with high path AI and what steps they're taking to prevent this virus from coming to their state. into their industry. So we've worked to do that with ISU and the U.S. Poultry and Egg Association. Also, the National Poultry Improvement General Council Committee will be reviewing this at their meeting this year, and they'll be coming back to us with ideas and guidelines about how to best arrange this. Now, we know one size won't fit all. One size won't even probably fit the individual operations, but there should be generalities that are recognizable throughout that plan that we put into those plans. And that's what's going to be expected by our Office of Management and Budget when we come to them and say, we have another outbreak, it's going to be another $1 billion. So we're working towards that. We're trying to assure the folks that we work for, and we're trying to ensure that we can have that avenue to go back to, and that it's not a difficult avenue and it's not a closed door. A little bit about our indemnity process. One of the things that happened in high-path AI is, and it wasn't a good thing, was that some of the industry has growers. They have growers that work for companies. The companies, in some cases, when the birds became infected, decided that they would take the indemnity, which left many of the growers holding the bag of cleanup with no money. We sat down to look at this and to design a new rule after our low-path AI rule that says we'll split those indemnity payments. We wanted those producers to have some type of compensation for the work they'd done up to the point when they became infected. Many of the companies did this anyway. We didn't really have to do it. But to ensure that everybody was treated the same, we changed our rule. So there is, in a new rule, it talks about split payments for contract growers. It talks about biosecurity self-certification, the fact that they had to have a biosecurity plan in place. And then we changed our way of looking at inventories also, because one of the complaints was when high-path AI hits you, day 2, half your birds could be dead. Our policy says we pay for live birds, which was designed to get people to report disease. We pay for live animals at the time of the disease diagnosis. However, with high-path, when it hits, the next day, half your birds could be gone, or 3/4. So we agreed to do an inventory up front when the diagnosis is first made, and to pay based on that inventory, not based on, and we'll use the barn records, the placement records, to go back and figure out what's the natural death loss, and what did they see once high-path AI struck. So it's a fair method. So this new plan also clarifies how we're going to pay for eggs. It includes a template that we're going to follow in regards to how the producers get paid. So it gets the money in the hands of the producers much quicker, and that's just the indemnity process. That's just paying for the birds and the eggs. I'm going to switch gears a little bit here and talk about depopulation. We talked about the challenges with depopulation in Indiana. And Dr. Roth mentioned, thanks Brian. It's dry in here. I'm just dry. Thank you. Dr. Roth mentioned the goal to depopulate infected flocks in 24 hours. Now that's a pretty lofty goal. But as Dr. Roth said, we know from testing, from research, that especially in Iowa, the longer those birds sit out there with the virus, the more they produce, the more they spread. And then once you depopulate that premises, the longer that virus stays there and the higher the logs of virus that you have to deal with. So the harder it is to clean and disinfect or to virus eliminate that premises. Some of the sites where we got in and cleaned them up right away, there was a difference of up to 6 logs of virus based on the ones that sat for a while and had birds on them for long periods of time. So that was our goal. We use different methods to depopulate, as you know, and this is an ongoing learning procedure, and no method works perfect. No method is great. Foaming is great for turkeys. Floor birds, broilers would work well. but it doesn't, you can't use it, and it's non-functional in a laying house where they're up 10 feet off the ground, 8 feet off the ground in laying cages. That became a cart mission where we use these depopulation carts, these CO2 carts. Those birds are taken out of the cages, put in the cart, they're gassed, and then taken down and disposed of. It takes a crew of 40 folks probably to do 140,000 birds a day would be a good goal. If you're in a facility that has 7 million infected birds, you can see how long that takes. So we have to come up with better methods to deal with these birds. And we're working with the industry, we're working with academia, we're working with the Department of Homeland Security to look at new methods and how we could do depopulation, combination techniques, and what that looks like. Ventilation shutdown. Very controversial thing for us. Was discussed. I think our agency and our department agrees that ventilation shutdown is a tool. It's a tool that we want to use as a last resort. If we can't make the 24-hour commitment to depopulate, ventilation shutdown will be considered. But ventilation shutdown is not simply turning off the fans. Ventilation shutdown is much more than that. It's adding heat, possibly adding CO2 in combination with turning off the fans. Turning off the fans is successful in killing large birds that are sick, but it varies with influences of what size the building is, what the house structure is, what kind of insulation it is they have in the house, age, size, type of birds, density of those birds. All those factors have to be considered. Ventilation shutdown, as far as we're concerned, is a combination of an agreement that comes between the USDA officials, the state officials, and the producer. So we want to have that conversation before that operation occurs. So that's the way it's defined on our website. And I think it gets confused. I've gotten a letter, and John's gotten several, about what ventilation shutdown is and is not from different humane societies in the United States. So I always want to be clear on that. We've also changed our thinking on, as I said, on what's clean. It's hard to define what's clean in different operations. Some people wanted to clean down to the bare metal and have floors that you could eat off of, and others simply wanted to remove the manure, turn up the heat, and remove the virus. We feel that virus elimination is the road to the future, and it's the best way to handle this. We simply want to get rid of the disease. After that, the cleaning that the individual producer wants to do is really up to them. So we devised what's called a flat rate payment for different poultry types. Each poultry type has a formula that's utilized. It's based on the cost for dry cleaning and heat to eliminate the virus, but it's also based on what we spent in Iowa and Minnesota to clean these flocks up, which, if you do the calculation, is a very generous amount of money, and we feel that a lot of these poultry operations should be able to clean and disinfect their facilities or virus eliminate based on the amount that we're going to give them for a flat rate payment. It does a couple of things. There's no haggling over cooperative agreements about who gets paid for what. It's a flat rate. We give it to the producer based on the number of birds in their facility. They take that money and they can choose how they want to clean and disinfect their facility, how they want to virus eliminate. And if they want to contract with contractors to do it, they can do that. If they want to do it themselves, they can do that. It's really up to them. The extent of the methods they want to use is really their choice. We pay them in 2 installments when they first start the clean, and that was another issue, that we couldn't get them the money up front. We couldn't pay them through cooperative agreements till they were done with the cleaning. This method allows them to have the money, 50% of the money up front. They start the cleaning process. Once their facilities test negative by environmental sampling, then they get the other 50%. So it gets them started, because these are things, I mean, you look into the eyes of these producers and they're handed a problem, and they had no recourse for how to get things done. These methods mitigate some of those issues. A little bit about industry achievements. The response that we saw in Indiana is just an indication of what planning can do and how well that worked. Surveillance and oversight, and how quickly they acted, and how they utilized the fall plan and the thought process and their preparation in getting ready. Had this happened to them in 2014, 2015, I think the response would have been much different. So that goes to the credit of planning and working together, which I talked about at the start of this talk. Support for that biosecurity is key. I know that when we were out in California, and I'm going to take us back, Dr. Breitmeyer, to when E&D hit, we worked with all of the laying facilities on their biosecurity, and we worked on communication, and we worked on all those things. And I'll say this, they've come to visit us in Washington, and they've maintained that, and I think that's a credit to them. And you can see the response that they had in 2014. They jumped right on it. They got it because they had memory. I think when states see this disease, they have memory, and you don't want this memory. So you want to be prepared. And credit goes out to the industry for what they're doing and the messaging that they're doing and the work that they're doing and how they're partnering with both the states and with the federal government. I can't say enough about that. And I can tell you no one will do this on their own. And the better prepared the industry is, the more we can help them, the less likely we are to see extensive outbreaks of this disease in the future. Surveillance is key. Biosecurity is key. And I'm going to talk about some other things that are really important too. So we're transitioning in a lot of ways in veterinary services in the agency. We went out after this outbreak and we tried to hire 300 term employees. Couldn't achieve it because they just aren't out there. That's a scary thing. When you start to look at veterinarians that want to work in this field, that are out there and are available, and animal health technicians, they're in short supply. So we did the best we could. I think we wound up with about 180 of the folks that we started out to hire. But we've changed our thinking in VS and in the agency and in the department. They formulated a new team called the VERC. It's the Voluntary Emergency Response and Recovery Team. And these are folks that we're going to train throughout our agency to just be in 57 different job descriptions to be ready responders. Guys with their bags packed, women with their bags packed, ready to go. We just started that program. We're getting volunteers now, and they come from all aspects of our agency, all parts of the department. They've also stood up an APHIS multi-agency coordination team, and they will be pulling in resources in the event of an outbreak, bringing everybody together and pulling the APHIS resources together. The department has also been challenged by the Secretary to have a departmental multi-agency coordination team, because what we're criticized for is trying to do it all on our own. We need to use the resources of other agencies, other programs, other departments to come in and help us in the event of an outbreak. And we're figuring that out. And that's something that everybody's talked about, but there's often been a reluctance to get down to the brass tacks. So that's going forward. We've changed our incident command teams around. We've restocked and rebooted. There's 5 teams now instead of 4. It's still not enough. We're going to be looking for help on that in the future. And the biggest thing I could say about the incident command teams is when we come into a state or a location, it's got to be a unified command. You have to be there with us. We need that. We appreciate that. We're not there to tell anyone what to do. We're there to join partnership and get the work done in whatever way we can, utilizing your direction and your resources as well as our own. The laboratories have stepped up. The National Animal Health Laboratory Network, can't say enough about those folks. They do a lot for very little. They're good partners. They help us with the surge capacity in the event of these outbreaks. Again, and the testing that's going on. couldn't do it without them, couldn't respond quickly enough unless they were helping us. People ask me about vaccination all the time. They ask us. It was interesting during the outbreak in Iowa and Minnesota. There were folks that wanted to vaccinate. There were folks that were absolutely against it. There are folks that needed to understand the nuances of what we deal with vaccination. And there's a lot of factors that are involved with that decision. We want vaccine as a tool, which is why we've went out with RFPs, and we've got vaccine that we begin to stockpile. That the vaccine that we have so far matches the H5N2. Of course, right away you have Indiana and H7N8, so that's a factor with vaccination. What vaccine you have in stock, and does it match the outbreak virus, and will it be effective? How it will affect trade is another issue. There's many sectors of poultry that are affected by vaccination, and the minute you start to vaccinate, certain sectors lose their export markets. For example, the broiler industry, they absolutely do not want to vaccinate. The purebred industry, they don't want to vaccinate because they lose their markets. So a lot of factors will be involved in that decision. But when you're affected and it's hitting you pretty hard and you want to protect your birds, but you want to vaccinate. But vaccination has to be understood. It's not protective. It doesn't prevent them from getting infected. It just lowers their virus shedding, lowers the clinical signs, and they may not die from the virus. But in my job, I would still have to take that flock. I would still have to take it out if it was infected. So we stand ready to utilize it if we have to. The decision hasn't been made to utilize it. It'll be a discussion that's made at higher levels than my job, and we'll follow whatever. It will depend on the outbreak and the extent. There's many factors that will have to be weighed before vaccination is considered or utilized. Wild bird surveillance. This has been an interesting discussion among many folks because there have been people that have followed the wild bird migration and tested behind them and haven't been able to find any virus. Dr. Slemons I was at a conference with him, and I asked him, I said, well, what do you think the deal was? Do you think it was just your test didn't work or you were behind the virus? He said, well, a combination of things, you know. Maybe the birds that went early carried the virus and they spread the virus, and I was following the later groups. Or maybe the virus was gone by the time I started to test for it. But I can't say enough about the work that's been done by the U.S. Fish and Wildlife Services, our own wildlife services, and other wildlife organizations throughout the states to develop the interagency strategic plan that they published in 2015, and that tells you the testing that they're going to do. They tested over 40,000 samples throughout the United States, and I would say that this is probably our best and earliest warning system, and it is an indication of what we can expect. Is it the end-all, be-all surveillance system? No. I think, but it's a tool, once again, that we need to utilize in addition to the NPIP testing and other testing that's going on throughout the industry. And I've already mentioned the H7N8 that was found in Kentucky in November. It was a duck that was very similar to the high path outbreak strain that was found in Indiana. So I can't say enough about the work that we've done with the Southeast Poultry Research Lab and the things that they provided for us in characterizing and referencing and preparing outbreak virus information. The studies that they've done on testing of the virus for vaccination and vaccination types, the epi studies that they've provided, and just the diagnostic developments that they've helped us with for testing and overall vaccine evaluation. We work with them closely, and they provide us a lot of help in those areas.